All right, how's everybody tonight? Woo. Beautiful course. Just want to start by saying thank you, of course, to CMCC and also to Mark Strong, who is the head professional here at the golf club. Did a tremendous job in the greens, rolling really good. Let's give him a round of applause. And my name is Dr. Caolan Teasdale. I'm a chiropractor and I'm also the assistant head professional at Westwood Plateau Golf and Country Club in Caolan. And over the next several hours, 3 or 4 hours, we'll talk about golf-related injuries, get right into it. No, we'll keep it about 45 minutes tonight, keep it pretty light, and then hopefully have some really good discussion from it as well. So things we'll talk about, first, why golf injuries matter. And they matter to a lot of us in this room as chiropractors as well. We're going to review the incidence and prevalence of injuries, most common, and do a couple of case studies. And probably the most important part of this one is a couple of ways that you can reduce the likelihood of getting injured. And just to show of hands, how many people have been injured from golf before? Ooh, a few hands. Yeah, throw them out there. What kind of injuries have we had?
Low back pain.
Low back pain, elbow, wrist.
Heartbreak.
CPR. So before we dive into it too much, here's a couple of recent injuries that kind of come to mind. The big one for us, Tiger Woods, knee injury, back injury. Somebody give him a chiropractor, please. Who watched the Players' Championship of the weekend? Yeah, not many people really did, because Tiger wasn't in the field. Kind of sad. But also, who's this guy over here? Do you recognize him? Anderson Silva. Tibia, goodbye. And who's this guy in the very bottom? Steve Stamkos. Did not go to the Olympics, was supposed to play with Sidney Crosby on the first line. Could have cost Canada a gold medal, but didn't. The reason why I bring this up is it has a dramatic effect, injuries themselves, have a dramatic effect on the sports that we play, but also on these athletes as well. So let's look at some of the playing habits of golf. First of all, golf's a pretty popular sport, we all know that, right? But in Canada, 5.7 million people played golf in 2012. And if you look at the breakdown of the numbers, kind of spreads it out a little bit. When I mention golf injuries, we're going to mention the avid golfer, 26 rounds per year. It's not that we don't care about these people down here, it's that they're less likely to sustain a golf-related injury. Okay, so when I mention golf injuries, it more applies to your avid golfer. And when we look at the spending habits of our golfers, let's just add this up. Green fees, apparel, equipment, golf lessons, really big one. Accessories, travel expenses, food and beverage. How much do you think the average golfer spends per year on golf? Any guesses?
Everything included?
Yeah, yeah. If you factor in everything in there.
12 grand.
So let's assume that these people already have a set of clubs, maybe they're getting a couple of regrips here and there. But, so your green fees, food and beverage adds up, go for a few pops afterwards for sure. The poll says in Canada, because of the weather, about 1,200 to 5,000 annually. In the United States, the weather's a little bit different down there, upper end is 65. So the point that I'm trying to make with this one is, if somebody gets injured, there's no more green fees. There's no more orange pants, no more white belts, no more golf lessons. And I'll put this in perspective for you. I had somebody come in January who, brand new golfer, wanted golf lessons. Showed him a brochure, picked the most expensive package that we had, and that was a 20 lesson pack. He bought that 3 times over. And we're doing lessons 2, sometimes 3 times a week. And he spent close to about $5,000. Second lesson, he asked me, should I go buy clubs? I'm like, yeah, you can go buy a box set, a cheap set, not a big deal. Comes back, went to Golf Town, bought brand new TaylorMade's RBZ, bag, balls, $3,500 right there. Imagine if that guy got injured. What would happen? Long gone, right? So that's why you send them to your chiropractor. Okay. So let's just take a look at some of the numbers. The annual prevalence of golf-related injuries between 25 and 62%. with some gender differences, and we'll talk about that why in a sec. The main risk factors. If you are over the age of 50, your higher handicap, previous injury, you are more likely to be on the 62% range. So in other words, if you're over 50, you're not a very good golfer, and you've had injuries in the past, you are more likely to sustain golf-related injuries, which is pretty big here. And if you're wondering what the professionals, so not the club pros, but the PGA, 81% lifetime prevalence of getting an injury. So Tiger, Phil, all those guys, 81% chance of getting injured at some time in their career, which is pretty amazing. Differences between your amateurs and pros. The most commonly part of the body with amateurs is low back, no surprise there. Elbow, wrist, shoulder. Pros, more related to overuse injuries as well. So what do we know so far? Whether you're an amateur or you're a professional, you are likely to get injured at some point in your playing career. And let's take a look at this gentleman here. Hopefully this didn't happen to anybody out there today. But watch what happens at the end of his golf swing. Oh boy. Oh boy. Oh boy. So why do amateurs get injured? It's pretty simple. Bad biomechanics. Bad biomechanics. That's why they take golf lessons. Okay. So before we get into all the injuries, let's just talk a little bit about the golf swing and where it's come and where it is today. So this is your classic golf swing that we've seen in years past, where we have a large upper body rotation as well as a large pelvic rotation. So we can see his belt buckle is rotating. And as he finishes, it's pretty symmetrical. And you might have seen this in old photos in the past. This is Sam Snead, one of the greatest golfers in the past. We see that the left foot comes off the ground, huge pelvic rotation, comes through eventually, and spine pretty straight. If we look at what the golf swing looks like today in comparison, Nicholas was kind of a big pioneer of this. The lower body stays relatively still compared to the upper body. And we finish in what's called the reverse C position. So we swing through the golf ball, and we have extension through the low back. Why is this important, you think? What do you think this does to the spine? Anybody? So it puts a tremendous amount of pressure through the spine. If we just take a look at the differences, this is before. Okay, pretty symmetrical. This is today. All right. Now in the 90s, Jim McLean, who was a pretty big golf professional down in the States, he took a look at this and did some research on it and some of the effects and what it was doing, because at the time the guys were just hitting the ball so far. And he coined this term the X factor. So if we keep the lower body relatively stable and the upper body rotates, it makes almost a perfect X at the top there. And when he did his research, who's this guy? Long John Daly. So this was in the 90s that he did his research. And we can see that relatively his lower body stays still, upper body rotates. And when you look at the differential between the shoulder turn compared to the hip turn, there's a difference of 48. And no surprise there, driving distance on the PGA Tour, he was #1. Anybody know what his distance would be in the 90s? It was about 290 yards. And he was a top. What's the PGA average today, you think?
340.
290. So it shows you over time what has happened. And if you look at the other side of that too, golf equipment, golf balls, they actually put sanctions on golf clubs that they can only have such a sweet spot on it now because guys are hitting it too far. So technology seems to have restrictions on it as well. The important thing is though, if you look at the spine and what's happening in this, if this is the spine here, it's kind of like taking a dish rag and you're twisting it. So by the time he gets up to the very top, there's a lot of tension and a lot of pressure through the spine. That's one of the reasons why people are getting back pain in golf. It's not the main reason, but it's one of the main contributing reasons. Does it make sense so far? Yeah? So let's just go into a little bit of spinal anatomy, just to review some of the things before we get into some of the big injuries. This is your low back here. Your spinal disc sits right in there and the nerve comes out. Low back, and there it is on the MRI. So there's all your backbones there, and those are the special discs that sit in there. Who's had a disc herniation before? A couple people. I actually saw one guy who was on the range, and he took out his driver, first shot, and went down the ground screaming. So it does happen quite a bit. So the major important parts we're going to talk about are these guys here. These are your facet joints, right in here. So they allow us to bend, twist, turn, do all those great things when we play golf. Okay, that's where all the rotation usually comes from, is in those guys. And we're going to talk about some of the injuries that are related to this as well. And again, this is the bones in your low back, lumbar vertebra, and also the disc that sits in between. Spinal cord runs right through there. Okay, so let's get to the first one, why most injuries occur. Posture problems. We're kind of experts in this field, I would take it to. Bad posture is really the plague of the golf swing. Once posture becomes an issue, everything else falls apart in your golf swing and you die a horrible, horrible death. Just joking. So one thing that we see here is he's quite bent over, okay? Yonda called this the upper cross syndrome. So essentially all the muscles in the back become pretty weak and all the muscles in the front become pretty taut. So people get in this hunched over position. What does that do? Leads to early disc joint degeneration, nerve compression, and sometimes atrophy and weakness as well. Effectively, what this does is it alternates the golf swing and it gives us a reverse spine angle and creates a lot of movement. So I'll just get you guys to stand up just for a sec. Let's just go into our golf position. Now let's just pretend that we have pretty poor posture. We're just going to roll our shoulders forward and try and take your backswing for me. So we're pretty limited, right, with the posture issues. So what most people do, you can go ahead and sit down. So what most people do is they watch Golf Channel, they watch Tiger Woods, and they see all these guys, they're bringing the golf club up to what's called the parallel position, where the golf club actually comes up and it almost sits on a little shelf, it appears. So what does that person usually do? They come to here, and then what they do is, oh, there we go. So the position in right now is called the reverse ski position, okay? What happens next is in order to hit the golf ball, I need to whip down into this position. And it creates a whip-like motion that puts a lot of pressure on the facet joints. So your right-handed golfers will get right-handed back pain because of that, because a poor posture leads to all this. One thing that Stu McGill kind of brought up, a good analogy is in the middle there's a fishing rod. It's pretty bendable in nature, right? But then if we take guide wires and we attach it to the ground, it's a pretty rigid structure. So in this example, the fishing rod is the spine and the guide wires are the muscles. So they can pull and push in any direction as well. So if you get into that position, a lot of different changes can take place in the spine as well. So just as an example, we take a look at a nice healthy C-spine here. In between, the discs all look nice and intact. Good posture position. On the other end of things, degenerative disc disease, joint disease, on and on and on, right? So posture really affects a lot of our golf swing as well. Another image down the low back as well. A lot of joint disease down in the SI joints and posture alterations up top as well. Now, the big one that I was mentioning, when we get into that lateral bend position, that's called the crunch factor. We see it in golf, we see it in lawn bowling as well. It's defined as an intense lateral bending during the downswing and impact, which usually occurs at high rotational speeds associated with low back in golfers. And 50% of all injuries occur at this impact position. So your amateurs, this is where they're going to get the majority of their pain from. is from that position. So when we talk about compression, how much compression are we talking about? A couple kilograms, what are we saying here? If we look at the stats that they did earlier on, the NIOSH stands for National Institute of Health and Occupational Safety. So it's kind of like WCB. They're saying, or they're telling us that if somebody puts 6,400 newtons of force, that's hazardous to most people. If they put 3,400 newtons of force, potentially hazardous. If you look at the compression in the golf swing, amateurs 6,100, pros 75. That's a lot of compression. And here's something really important too. Peak compression loads during the golf swing has been shown to be 8 times the weight compared to running, which is quite a bit. And for your disc herniations, going back to that, the most common cause of your disc herniation in a healthy disc, lateral bend compared with compression and torsion, which are all major components of golf swing. So a good question would be, why can pros actually put more compression instead of amateurs? Why do you think that is? What do you think? Muscle? Yeah? Anybody else? Flexibility? So it was actually found that when professionals swing, the muscle activation is a lot less. Pro or amateurs try and really give it, and all the muscles are activated at the same time. The also really cool thing is, with your professionals, when you look at their x-rays, on the right-hand side, their facets are all worn down, okay, which is pretty neat. So there seems to be a protective mechanism behind that, so they can put more force through the body. And just tying it all in together with those facet joints, this looking at a cross-section, so looking down at the person. So this is the disc, this is the spinal column in here, nerves come out. What happens is, as we compress those facet joints that allow us to move, bend, and twist, there's a lot of pressure that goes on the nerves as well. So you get a lot of inflammation in there. It can create a lot of hypertonicity in the muscle, or spastic muscles at some point as well. So let's just take a look at, for an example of this. This is, you might recognize him. This is Rocco Mediate. Almost beat Tiger Woods in the US Open. But let's look at how he swings. He comes up. He rotates very little, he comes down, and almost no crunch factor with that. So there's not a lot of lateral bend. He actually had a previous injury, and he had to change his swing so that he was able to play a lot longer. So watch it again. Comes down, right there. So almost no compression that he's having with that swing. Now, if we look at a company called Made to Measure, how many people have actually had club fitting before? Yeah, helps a lot, for sure, right? There's a company in Germany that took this a little bit to a farther extent. Let me just show you the difference in what they did with this golfer. So we're looking at that crunch factor, that lateral bend that they're getting into. He's using a 7-iron in this position. Okay, so if we look at the impact position and the difference, on the left-hand side there's a lot of compression. On the right-hand side there's almost no compression. He's using a 7-iron for both of these golf swings. What they did is they lengthened the golf club 4 inches so that he was able to play because of posture issues and back pain, which is pretty interesting. Even if you have a guy who's 6'4", in North America we only usually extend the golf club about 2 inches, which is pretty crazy too. So a lot of people that are taller don't really have a chance at playing proper golf. So that's one way to go about it as well. Not sure if it's going to make its way over this way, but it's pretty dramatic. There's almost no compression on there as well. So let's take a look at this guy. Let's watch his golf swing. Ooh. So what's wrong with this swing? Well, there's a lot of things wrong. But what's the main issue you think with this guy? He's 17 years old. Posture. So does he have degenerative disc disease, degenerative joint disease? Does he have Yonda's upper cross syndrome? What's wrong with him? What do you think? Yell it out.
Video games.
Video games. Yes, clubs are way too short. He's 6'4", this guy, 17 years old, and in his hand right now is a 9-iron. Okay, if you look at a side profile of him, he's got actually really good posture. So he's playing with really short golf clubs. Even if we lengthened his golf clubs 2 inches, it might not even be enough. So that's one thing that we could suggest is a new style of club fitting. Okay, you can adjust lie angles, you can adjust the shafts, all those great things, but when you get a tall player, it makes it really difficult for them to play golf. And he loves golf, it's just that he's not using the right equipment. And it's actually quite comical. This is his putter, and it comes up to right about there. Okay, how are we doing so far? Making sense? So let's go on to the elbow for a sec. We'll talk about golfer's elbow, tennis elbow, all those great things. So golfer's elbow, everybody take your elbows out. So golfer's elbow, tennis elbow. Golfer's elbow is on the inside, and your tennis elbow is on the outside of your arm, or medial and epicondylitis. So what we see is all these muscles, they come up and attach to those bones there. And what's actually pretty interesting with golfers is lateral epicondylitis, or tennis elbow, is more common, 4 times more common with golfers than it is with tennis players, which is pretty interesting as well. But one thing that we do see a lot of too, there's a nerve that comes down through here. That's your ulnar nerve. So every time that you bump your arm or you say, oh, that's my funny bone, it's not so funny when it actually happens, but that's your ulnar nerve that gets compressed. And that can happen quite a bit with golfers as well. Has anybody had this before? Golfer's elbow, tennis elbow, those things? Okay, well, how prevalent really is this? 32% of injuries in amateur golfers, so it's the second most common. Up to 20% in medial epicondylitis associated with ulnar nerve, so it's pretty prevalent as well. And 85% of your elbow injuries occur in the lateral aspect. So your tennis elbow is more common. So why do you think that is? Why would it happen more in the lateral side than the medial side? Any thoughts about that? So one of the reasons why people get elbow pain is because they squeeze the golf club too hard. When you ask somebody out of 10 how hard are you gripping the golf club, they usually say 12 a lot of the time for the beginners. So we really want to be at about a 4 or 5 for that as well. Elbow straps. Who uses your elbow straps? Do they work? What do you think?
Today, yeah.
So when we look at some of the research with the elbow straps, that's a big question a lot of chiropractors get. Should I use them? What brand? Yada yada. The recent research is more or less inconclusive. It's saying about 50% of the time it works, half the time it doesn't. It's kind of hit or miss. And the analogy behind this is if you think of a guitar and you put pressure on the strings of a guitar, it decreases the amount of tension being placed on that structure. So that's one thing that the elbow band does, is it decreases the amount of tension. So that's one thing that brings it up. So we'll go on to wrist injuries. Who's had a wrist injury before? Yeah, big ones? So going down the list, 11% of injuries. The big ones, hook of the hamate, TFCC complex, we'll get to that in a sec. The most common mechanism, hitting an object other than the ball it impacts. This is Rory. This was, I think in the US Open he had this. His ball was by a tree shrub, and he hit down, and he hit the root instead. And I think he pulled out from what I remember. But just taking a closer look at this, this is the hook of the hamate. So a little bone here. And it most commonly gets fractured with the left hand as it comes down and takes a pretty steep divot. And there it is on x-ray there. And if we look at the golf swing with the wrist positions, it's not that difficult to see why we're getting these injuries. So this is a right-handed golfer, obviously. We see that the left hand is coming across, and he's spending a lot of time in radial deviation. So that's one of the main effects that also creates an injury. When we look at the other aspect of it, the right hand, a lot of extension as well. So a lot of movement in the wrist. And at the impact position, the left hand comes forward, and there's a lot of compression, and all the force that goes through the golf club down here gets transmitted up to the wrist. So people that play in wintertime, when the ground's actually pretty firm and they take divots, that's where injuries are more likely to occur as well. Okay, so let me show you a couple of videos. I'll show you this guy. What's going on with this guy, first of all? Yeah, bad posture right again. Let's just take a look at his golf swing. Ooh. All right, so this guy walked in. He said, you know, he's about 18 handicap golfer, wants to get down and scratch, and I just need 3 lessons. I'm good. So I'm like, well, this guy might be pretty good. Okay, let's just take a look at an AP view of his golf swing. Oh my goodness. So what do we see? What do we see? I'm going to see on the golf course today, actually, but what do we see with this guy? A lot of stability issues, right? A lot of problems in his lower body. He doesn't have a stable platform as he's swinging, right? One more time, just watch his feet. Oh boy. So in a professional sense, as a golf professional, we call this something a very specific term. Does anybody know it?
Reverse pivot.
Reverse pivot, yeah. Anything else? We call this a total and utter disaster. That's what we call it. We go like this. And I told them, you know what, this is going to take more than 3 lessons here. So we signed them up. We did a 6-month package with them, and I said to them, oh, you know, by the way, there's a lot of posture issues going on. I really feel that you should come to our clinic and we can do some really good work with you. So he ended up being a really good patient of ours. You can see he's wearing his traditional golfing outfit. The grass at Westwood is a little bit darker, or a little browner in the summertime. So we brought him in. His posture still isn't the greatest. Worked a lot on his upper T-spine, his hip. Worked a lot on his ankles. Really weak ankles. So we tried to create a more stable platform with him. Let's see where we're at. Let's just look at an AP just to make sure we're not being deceived. Not bad, eh? So golf and chiropractic does go together. All right, what about kids? What about kids? This little guy, 8 years old, he's one of the best soccer players in the Lower Mainland. Let's just take a look at his golf swing though. Let's see what he's got right now. Pretty, you know, we see that a lot in kids. One thing though, see how his head's down? This kid was actually pretty interesting. He was a perfectionist, and golf, as we all know, is not about perfection at all. So when the ball didn't go straight 100 yards, he'd get really upset. So we definitely worked on his golf swing, worked on with him about 8 months. I'll show you the next video in a sec. But he ended up coming to our clinic as well. The big thing that we worked on with him was, again, stability. We did a little bit of work up in his thoracic spine and on his lead hip as well, just from the amount of soccer that he was playing. And let's just take a look at where he is now. So the grass, a little bit different in color. Let's take a look at his swing. Not bad. So he has a much stable platform. His hips are able to clear so that the golf club can come through and make better contact. So chiropractic in kids also really important. Okay, so we'll talk about preventing golf injuries. Any questions so far that we covered? So that's the injury point of view. I'm going to talk about now how to prevent injuries and what you can tell your patients as well. Okay, any questions at this point? Okay. Number one thing, if you forget everything I say today, this is the big one. How many people actually warmed up today? Okay, that's pretty good. Pretty good. So statistically, only about half, 50% of people actually warm up. So if you could do anything, warming up is probably the best thing that you could do. Ideally, 30 to 60 minutes is your time frame to hit golf balls, relax, hit a few putts. that's the best thing, best case scenario. Even if it's 5-10 minutes, that's better than nothing. How many times do we see guys pulling up in their cars, running up in their bags, going to their first tee, and it's usually the driver that we always hit first, right? A lot of injuries happen that way. You get the same story, oh, it took me 4 or 5 holes to warm up, and this and that, and not so great. So how do we warm up? Dynamic stretching instead of your static. So dynamic is any type of movement or any type of motion that increases the range of motion at a joint through your motion. Your static stretching is your classic hold and stretch. Okay? The reason we do that is there's a couple of really good studies that looked at this. It took 2 groups. One group did static, the other did dynamic. The group that did static, they actually lost about 15 yards off the tee, and your accuracy and club head speed went way down. So dynamic, afterwards you do your static. Weighted golf clubs. How many people use like 2 golf clubs, a swing to help loosen up, or yeah, sometimes even Golf Town sells a weighted disc that you can get over top of your golf club. We don't want to use that anymore. One of the big studies that they did as well is it actually decreases your swing speed down. It tells your brain that you're swinging a 2x4, and people lose more distance again. What do you do alternatively? You flip the golf club upside down, and you swing it as fast as you can with no weight. And it tells your body that it's okay to swing hard at it. So, how many balls should we hit, by the way? How many balls should we hit? How many people warmed up, went to the range? A few people? How many balls did you hit, you think?
30.
30? That's a pretty good number. There's a lot of people I see in tournaments, they come about 2 hours early, and they hit about 300-400 golf balls. All right? There's a difference between warming up and working on your game. When you come to the golf course, you're about to play, you're warming up. You're no longer working on your game. That's reserved for something, a separate time. So 20 to 50 balls is where you want to be at for that. Let's just take a look at this person's warm-up. May you recognize him? He's the most interesting golfer in the world. Miguel? He's got the cigar hanging out. The knee twist, I like that one a lot. That one's pretty solid. That's a little stretch. Still uses the 2 clubs. He just got married actually last week. So he's a pretty classic guy. So next one, this is kind of an obvious one. Take a golf lesson. You're going to be more biomechanically efficient, and here's a really good stat, or a good quote, can decrease the incidence and prevalence of low back pain significantly. This is why your golf pros and your chiropractors, they work really well together, because it keeps them both in business as well. The golf pro's happy because they're healthy, they're taking lessons, which is really important. How many people took a push cart today? Good. Did you push the cart or did you pull the cart? You pushed it. This is a really big problem that we see on the golf course. You see on the left-hand side? These people here are pulling their golf cart behind them. And this is where a lot of injuries tend to happen, is as you're pulling it, people give it a sudden shrug or a sudden jolt. And that's where a lot of the injuries do occur. Our friend on the right-hand side, he's pushing his cart, he's smiling, he's happy, he's having a good day. He'll continue to have a really good day. Keep the load as possible to your body. So pretty simple things that we go over with patients every day, but we don't say it in relative terms to the golf course. Good stat, golfers who carry their bags suffer significantly more injuries to the low back, shoulders, and also the ankle. And don't want to push any products, but this is a really good one. This is a click gear. Has anybody seen this before? It is, yeah. It's a great product. It's probably the best maybe made by a BCIT student. He's laughing all the way to the bank now because this is by far the best seller. Folds up really nicely, super easy to push as well. All right, lighten the bag or be the driver. Profound number of injuries occur not on the golf course, but rather in the parking lot. Isn't that bizarre? How would that happen, you think? People put a lot of stuff in their bags. I'm not sure if you've seen this. People put 2 dozen Pro Vs, 2 shoes, rain gear, umbrella, 12-pack of beer. It's incredibly heavy. And when they bend down to take it under their trunk, that's when injuries happen. They get it out, they twist, and their days are over before they even get on the golf course. So here's a really good tip. When you go play the fancy golf courses, they take your bag out of your trunk for you. So when you come up to Westwood, they'll do that for you. Okay? Pretty simple again, bend with the knees, keep it as close as possible. Golf bag. This is really similar to your backpacks. Backpack safety with the association that they did a really good job with as well. It should be roughly 10% of your body weight with your 14 clubs, a few balls, don't need your rain gear that day, no umbrella. So if I weigh 150 pounds, my bag cannot be more than 15 pounds. That's really important if you're going to carry your bag, okay? This is a big thing that a lot of pros, I'm kind of guilty of it myself, but we need to work on is this junior, his bag is way too low, and it's actually hitting him in the back of the leg. So the load is way too low relative. And these people here on the right-hand side, they got a single strap. How many people have a single strap bag? Yeah. So they're, this is the first hole, they're smiling, having a good time. They will not be smiling, I guarantee it, on the 18th hole because of this, okay? So the backpack straps are really good these days, and they're super, super light. Interesting one, how many of us took a golf cart? Who took a golf cart today? A few people, okay. If you're going to take a cart, good thing to be is the driver. When you're driving the cart, you're more able to anticipate the terrain, sudden stops, things like that. So I've seen whiplash happen in golf injuries as well. That's a big one that you want to look out for. So always insist on being the driver. And last one, this is a kind of an easy one too. Seek help. There's a chiropractor, physio massage. We love them too. We love these guys even better. Correct your posture alterations. Do not leave an injury unchecked. Orthotics. How many people deal with orthotics? It's a great product. Did a couple of independent studies, and they found that when they did fit them, the club head speed increased about 3 to 5 miles per hour after they wore custom-made orthotics. The thing behind that was when they take a golf swing, they have more stability in the lower limb. So if you have stability issues, you might want to look towards orthotics. And also, they didn't seem as tired towards the very end as well. So again, thank you for your time. Is there any questions though? Yeah.
First one, what's miles per hour gains how many yards of speed? So 1 mile per hour would be 5, 6 yards, or 3 yards?
Yeah, it depends kind of on the person and their swing, but usually it's about anywhere about 3 to 5 yards. Yeah. Would you say the same, Jen?
Pretty much.
Yeah, about that. Really depends on the person. Because if they have a swing flaw, it can be going 3 to 5 yards in the wrong direction.
Yeah.
So it really depends if they're hitting a draw, because a draw is one of the most powerful shots you can hit.
Right.
It's where you get the most compression of the ball, especially.
That's like 3 to 5 miles per hour.
It's a pretty big jump.
Significant. Yeah.
That's pretty significant.
And so your bag weighs 20 pounds?
My bag weighs about 15 pounds.
Really?
Yeah. If you're looking for a bag, Sun Mountain has a really good
I
bag.
mean, with clubs, everything?
With 14 clubs, yeah.
Really?
Yeah.
It carries 2 balls.
The Sun Mountain bags are the best. The Ping bag is the one that I have, and it's pretty lightweight as well. So you still want to try and get to that 10% margin. Yeah.
So 14 clubs would only weigh 15 pounds in the bag?
Yep. Yeah, it depends on the bag. The cart bags, the ones that have the single strap, those things are beasts. And the bag itself can weigh about 10 pounds in itself. The double strap bags, though, are actually quite lightweight when you pick them up. Yeah.
Would you recommend avoiding driving range mats if you could?
Just the general cages, you mean?
We're talking about the incidence of wrist injuries and hitting irons off repetitively versus grass tees.
Yeah, I mean, grass tees are ideal. Not too many golf clubs in the Lower Mainland have them. We kind of saw that today. I think these guys do have grass tees, but Northview is kind of the closest one that has a grass tee area. The mat itself isn't too bad. There's a rubber foam piece underneath it. And a lot of golf clubs are going to a separate AstroTurf type of material, so it's even softer yet again. The one thing I would avoid with playing golf is in winter conditions, when it gets cold outside, and so do the mats themselves in the wintertime. So even though you have heaters behind you in some of the stalls, you're still coming down into a piece of rubber that can be pretty icy, pretty thick. So ideally grass tees, but we don't see a lot of them in our mainland, unfortunately. Any more questions? No? So thank you very much for your time, and have a great night.
Okay, so we're going to do the raffle. I'm just looking at the bid sheets here. 1, 2,